Cool.
Well, good morning. Happy to welcome you to the next installment of our series that we're calling Sharpen Your Dairy Skills as We Flatten the Curve. Thanks for joining us today. Really pleased to have a colleague of mine, Dr. Richard Pursley from the Department of Animal Science at Michigan State University, here to speak with us today about reproductive management as a tool really to achieve high productivity in a dairy farm. So Dr. Pursley has a bit more tenure than me at Michigan State University. He's entering his 25th year at the university now. He's in an extension and research role focused on reproductive physiology and management, and is probably best known as one of the co-developers of the Ovsynch protocol. So he's really had a huge impact on the dairy industry through those efforts and others. If you're joining us this morning, I want to encourage you to please feel free to submit questions using the chat space and the YouTube interface. We will be addressing those sort of as we have a good spot during the talk or at the end, but please don't wait till the very end to get those submitted. And with that, Dr. Pursley, thanks for taking time for this today, and look forward to your presentation.
Thanks, Barry. It's certainly a privilege to do this. We're so excited to have you as our new Meadows chair, and I think this is one thing that, you know, you've only been in the position a couple of months and really making a big impact already, and we really appreciate it. So congratulations on this series, and hopefully I can bring some information to the table that'll help people out there during this period. So we're going to be talking about increasing daily milk production, and I know that may not be a great topic for today since we're in the midst of dumping milk out there. But as we go along, you'll understand, I think, why we're still going to talk about this, and because it really has implications more for next year, your milk production next year. So we'll get started. So this is Cells Prale, if I pronounced that correctly, aftershock. I think it's 3918 is her number. She's currently the world's champion for milk production. You can see there how much milk she produced in a year. And it's kind of interesting because as we go along here, we don't have a ton of these cows out there, but we've got a lot of cows catching up to this cow. And the management of these cows become more and more important. So as we go along, we're milking fewer cows, we're getting more milk out of cows. This is the way it's going to be as we go forward, and don't see that changing. It hasn't changed for years and years. Don't see it changing in the near future. So these cows are become more and more valuable in this case, and they need the opportunity to get pregnant year after year in order to maintain milk production. So this is actually the world's leading record holder for total pounds of milk production, Smurf. And I think Smurf died a couple of years ago, if I recall. She had 11 lactations. You can see the milk production there, quite impressive. But this cow kept going and going. She obviously didn't have any problems reproductively there, or she wouldn't have done that. But pretty impressive. So these are the cows we're working with here, and this is the environment that we're working in, at least here in Michigan. This is actually a picture of a barn in Wisconsin, to be quite honest, but our barns here are, of course, very, very similar, same types of barns. And I love this picture. This is a picture that I was able to get Paul Fricke to give me, and appreciate that if you're listening, Paul. But I love this picture because these cows are incredibly comfortable, and you can see they're not overcrowded. The fans are there for when they need them, and they're clean. This is perfect. And this is the kind of situation we need to be in order to make headway gains, both in milk production and in reproduction. So this is the ideal situation. If we can do this, this ticks a lot of the boxes, and this will allow you to make a lot of improvements with regards to reproduction. So I'm going to take you back, take you back a few years to 1992 when Jack Britt at North Carolina State University, he was at Michigan State prior to that, had a hypothesis that the amount of milk that cows produce early on might affect their fertility. And the interesting thing about this, it really works well with what we're seeing in recent studies. But I wanted to show you this, not big numbers here, but he basically had two groups of cows here, cows that either maintained or gained body condition during the first 10 weeks of lactation, or cows that lost body condition. So I don't have the curve here to show you, but the cows that lost body condition started out with higher body condition and ended up with much lower body condition than the cows that maintained or gained. The cows that maintained or gained actually started out with lower body condition, but either maintained that and gained. So with that in mind, 46 in that group, 30 in the lost body condition group, you can see the milk production really wasn't much different there. But first service conception rates was incredible. That's once again low numbers, but a big difference there in fertility in these cows that did not lose a lot of body condition following calving. This is the key, and all services there, you can see the difference. So kind of interesting. It takes us back a number of years with his hypothesis, but more recent years, in 2014, Carvalho et al., it's over at the University of Wisconsin, published these data in which they had two herds in this study, and they divided out cows that either lost, maintained, or gained body condition during the first 21 days of lactation. So they went in around the time of calving and then back 3 weeks later, determined how much body condition these cows had either lost, maintained, or gained. And then all these cows were on double Ovsynch in this case. And you can see that at 40 days in milk, the two herds combined had much greater conception rates in the cows that gained body condition during that period compared to the cows that lost or even maintained in this case. At 70 days, of course, that held up, not too many losses there. So really interesting. As you look at this study, though, it's a tale of two herds. This study is really interesting, and herd two really carried the ball on this one. And you can see that the cows that lost body condition in this case during the first 21 days really had low pregnancy rates per AI. 15.4 in the farm two. If they maintain 36% pregnancy rates per AI, and then you cannot see that number up there, but it's around 80% that were pregnant if they gained body condition. That's incredible. Then you compare that to herd number one, that you still see a nice increase, about a 10 percentage point increase from the cows that lost to the cows that gained in this case, but not quite the differences that you see in herd two. So not really sure the same, basically the same owner in this case, but two separate herds, and not sure what the differences were in that herd, but you can see there can be some differences amongst herds in this case, but still overall had this interesting impact of what's going on physiologically with the cows following calving in this case, and really interesting. So I had a really good student that graduated last year, Emily Middleton. She's still in the state of Michigan, working in Michigan as a nutrition consultant now. But we got to talking about these data, and so we set up an experiment for her. It actually started when she was an undergrad, and then carried on into her graduate degree. This is the paper, one of the papers that she published out of her master's degree. It's we call it the high fertility cycle: how timely pregnancies and one lactation may lead to less body condition loss, fewer health issues, greater fertility, and reduced early pregnancy losses in the next lactation. So we dug in a little deeper into this interesting topic that deals with body condition loss following calving and fertility. And so here's some of her data. Basically, this figure shows we're looking at the previous calving interval's effect on body condition score at parturition, as you would expect. The longer the previous calving interval, the fatter these cows were at the time of calving. So you can see if we put a 13-month calving interval in there, you can see that these cows that had the longer calving interval basically had the higher body condition score at the time of calving. So these cows certainly would be losing more body condition in this case. So if you actually look at the previous calving interval and its relationship to body condition score change, and in this case, we were evaluating cows at the time of calving. So we would go out every week. If they had not calved, we would give them a body condition score. By the next week, still hadn't calved, we'd give them another body condition score until they calved. So we would be within 7 days of calving on that body condition score. Then we went out 30 days later and gave them another body condition score. And then we took took the difference. And so we're looking at loss or maintained or gained. In her study, we didn't have the number of cows that the study in Wisconsin had. They had a large number of cows, and they had a big group that actually gained body condition. We didn't see that here. We did have some cows that gained body condition, but you can see that in the body condition score change on the x-axis, it goes from greater than or equal to a half of a score during that 30 days to a half a point during that 30 days to greater than zero, greater than or equal to zero. So some of those cows would have either maintained or they would have gained. So you can see here that longer the previous calving interval, as you would expect, these cows that calved in fatter had a greater body condition score change, and they lost more body condition. So a lot of it's just about what happened the previous lactation. If the previous lactation is too long, cows are going to get fat. They're going to lose more body condition, and I'll show you what happens to those cows in a moment. One of the big things that happens to those cows is that these cows have a lot more health issues. You can see that 30% of the cows in the group that lost the most body condition in her studies, in her study, had some type of a health issue following calving. It could have been retained placenta, metritis, those types of things. Most of them were actual reproductive health events, but certainly a lot more problems in the cows with the greater loss with regards to health events during the first 30 days after calving. And you can see these cows that maintained and gained much fewer percentage of cows with health events. So these cows get fat, previous lactation, they calve in, they lose too much body condition. One of the things that happens is in those cows, they're not doing quite as well health-wise, interestingly enough. Okay. Then we looked at percent cows pregnant after first AI. In this case, they were on a G6G program, and you can see that the younger cows, there was no difference in conception rates, 55% conception rates in the cows that maintained or gained body condition versus 48% in the cows that lost body condition. But in the multiparous cows, there was a difference. We had enough, we had more cows in this particular study. That could have been part of the reason, but But in this case, there was a difference here, and the older cows that maintained gain body condition had a 48% pregnancy rate per AI versus 36% if they had lost body condition. Now, the interesting thing about this, we removed all the cows that had periparturient health events, just so that it wouldn't confound these data. Interestingly enough, when we left that in the model, it really didn't affect anything, to be quite honest. But we took them out anyway, just to show that this effect was not confounded by cows that had health events afterwards. So this is strictly due to differences in body condition losses during the first 30 days in milk. The other interesting thing that happened here was when you evaluate pregnancy loss, and this would be 3 different periods. These cows that received first AI were pregnancy diagnosed on day 35 days after that, then at 60 days, and then at 119 days. And then we had data on those cows out to calving, actually. And the interesting thing was that in the cows that maintained and gained body condition had no losses, actually, in the first from 35 to 60 days. We hardly ever see that. It kind of made up for itself a little bit in the cows that lost body condition. The cows that lost body condition kind of made up for itself in the next period there from 61 to 119. But in the cows that lost body condition, they were at 8% losses during that 35 to 60 day period. So if you just look at that period, pretty interesting. That was the only period that was actually different statistically, and the others weren't. So interestingly enough, but there could be something there also with the developing embryo, the environment the embryo is growing in, et cetera, that makes those cows a little different. The cows that lost body condition, we're not sure how that would work, but certainly it could be a possibility there.
Richard, I have a question here that for that study, I mean, this question could impact interpretation of some, different parts of your data, but do you know, did they keep cows on different diets at different stages of lactation? And was that a single herd?
Yeah, that was a single herd. And those cows, if I recall, were on a little bit of the later lactation cows are on a little different diet in that particular herd. So different than I think they basically have 3 rations. They have the early lactation ration, and they've got a ration that goes out to 28 days, something like that. I could be wrong. I think I'm pretty close on this. And then the ration changes at around 28 to 35 days. Then I think it's just all, once these cows get out into some pregnant pens, then the diet changes, later lactation cows.
Okay, thank you.
All right, so this is what Emily put together. So the bottom line here is that we call this a high fertility cycle. The reason we do that is that if we can get cows pregnant, it turns out by 130 days in milk, we're rethinking that just a little bit. We'd prefer to see that at 150. Her data broke out very clearly at 130 days, to be quite honest. The less body condition loss we have, the fewer health issues we have, the greater pregnancy rate per AI that we have, and then we have reduced early pregnancy loss. The reason we call it the high fertility cycle is if we can get these cows pregnant early, they calve in at a perfect body condition score of around 2.8, somewhere in there, 2.7, 2.8, and those cows then will not lose much, if any, body condition. They'll have a greater chance of maintaining or gaining body condition in the first 20 to 30 days following calving. So So, and if that happens, then they've got a much greater chance of becoming pregnant again. So it's a cycle that we'd like to see these cows get into. That's why we called it the high fertility cycle. There's clearly an effect of these cows, or at least a really strong relationship of these cows that once again maintain or gain body condition and have a much greater chance of becoming pregnant later in these older cows. So that's Emily Middleton's study, a really nice study, I think, that helps us think through some of these things, dealing with reproduction and making sure that we get these cows pregnant soon enough so they don't get too fat and calve in and lose a lot of body condition and have health problems and likely a less chance of becoming pregnant. Okay, so here we go. We're really working. We're giving us a little bit of flexibility. We're basically saying we want to get cows pregnant. All the cows that we're going to get pregnant, we want them pregnant by 150 days in milk. And if we can do that, we eliminate a lot of these fat cows calving in. So one thing we can do is to try to squeeze this together a little bit more to get all first three AIs in before that period. That gets to be tricky. And it's also incredibly important that we get as high of fertility at first AI as we can get. So best case scenarios on this. So if we can do that, if we can push those together, I'm going to go back. If we can push those together, then we should be able to reduce a calving interval. And if we can do that, we get a much greater percentage of cows in peak milk production. This is the key here. So when you think about the nutrition consultants out there thinking about all these herds you get into and doing the best job you can of balancing rations to get these cows to produce as much milk as they can, think about this. Your job would be a whole lot easier if we had the ideal percentage of cows of the herd in peak milk. And conversely, if you've got a lot of cows out there in late lactation, man, I'll tell you, it's hard to get much improvement in these herds. You're working hard to do what you can to get the rations balanced, but you're really dealing with stage of lactation in this case, and certainly would make your job a lot easier if we can push this thing to where we are getting the greatest percentage of cows possible of the herd in peak milk at any given time. Make a huge difference in what you can do with your rations, and it's kind of like us, where I started out talking about, we really need to have really comfortable cows. You need comfortable cows to produce milk also, but we need comfortable cows to make big improvements in fertility, to be for sure. You need to have, those of you that are balancing rations out there, you need to have the greatest percentage of cows possible in peak milk. And once you have that, you can make a huge impact in that herd. There's no question. So think about that. I think it's something we don't push enough with these programs. You kind of deal with what you're dealt with on those farms with regards to reproduction. But think about that, because I think that's not as important, but it's certainly something that you need to be thinking about to improve overall milk production in these herds. So, when you talk about best case pregnancy rate per AI scenarios, when you include losses, you're somewhere around 40 to 50% for first AI, 30 to 40% for second AI, and 30 to 35% for third plus AIs, third AI in this case. Those are best case pregnancy rate per AI scenarios in the northern part of the United States. That includes losses. And if you can do that, then your total pregnant after 3 AIs would be 70 to 80%. That's incredible. If you can do that, there probably are a few people out there doing that. It's the goal. Certainly, it allows you flexibility in culling strategies. The thing you got to remember here is that this is all about you're doing this now to plan for milk income a year later, basically, or even a little bit longer than that. So this increase by pushing these three, getting all your cows or as many of your cows pregnant as possible, and most of you are only going to get 70% or so anyway that are going to make it to the next lactation in this case. So that would be fantastic. And to end up to be able to do something like this, you certainly got to think about it as something you're doing now to prepare your herd for next year sometime and over a year later. So it's not a direct impact what's going on right now, but certainly it's going to have an impact later on. And that's kind of the way you got to think about it. But certainly if you can push those cows into a much tighter situation with regards to time between first and second AI, second and third AI, and you can get all those in by 150 days. And you can get somewhere around 70% of those cows pregnant and calve back in. Fantastic. That would be pretty amazing. That's the goal. And certainly that would go a long ways in increasing the percentage of cows that you would have once again at peak milk. And in that case, you'd be increasing average daily milk production for the herd. Okay. All right. So in order to do that for first AI, pretty tough to do that if you're only detecting estrus for first AIs. The problem with that for first AIs for sure, and detection of estrus, is that you're waiting on those cows to show estrus so that you can inseminate them. You're going to have a certain percentage of the herd that are going to be anovular, that will not be showing signs of estrus. And so you can't control time to first AI in this case. And the other thing you can't do is pretty decent data, and I'll show you this in a moment, with regards to estrus versus some of these programs. And pregnancy rates per AI following estrus are just not high enough. In any of our studies throughout the US, people doing these studies, not high enough to consider in this particular scenario where we've got to get 40 to 50% of the cows pregnant at first AI in this case. And the only way to do that is to use one of these three programs right here: double Ovsynch, Presynch 11, Presynch 10 or 11, or G6G. So here's double Ovsynch. Double Ovsynch, if you're not using it, if you haven't heard of it, it's two Ovsynchs. The first Ovsynch in this case, logistically, in this particular scenario, starts on a Friday, and you can see it's a GnRH. The next Friday, PG. The following Monday then is the last GnRH of the first Ovsynch. Then you got to wait a week and do the Ovsynch all over again. So in this case, you'd be looking at the first GnRH of the second Ovsynch starting on day 7 of the cycle. And that's the key to any of these three programs, is that we're starting Ovsynch at around day 6, 7, 8, 9 of the estrus cycle. And that's the key. That's how that's why it works. I'm not going to get into all the physiology of that today, but that's certainly the key for why these programs work very well, and they do increase fertility. So basically what happens in this case, and this was a study that was done in Milo Wiltbank's lab at the University of Wisconsin, that if you can do that, you've got pretty high progesterone between by the time you get to the prostaglandin of the second Ovsynch. And one thing I just noticed in here, I don't have a second PG in here, but in this particular study, they did not have a second PG. They only had one PG in here, which is kind of interesting. And so they had higher progesterone. Then they changed the protocol around so they could get low progesterone. And you don't want to do this. Don't take a picture of this. Don't remember this. All this did basically for their study was to get cows under very low progesterone between the time of the GnRH and the prostaglandin. So by the time you get to the prostaglandin of Ovsynch down here at the bottom of the page, you're pretty low progesterone, and probably maybe close to half the progesterone in this case versus the scenario of double Ovsynch. So basically we took the last GnRH of the first Ovsynch and used it as the first GnRH second Ovsynch. And we're starting under very low progesterone. This is not a program that we use unless you want to reduce fertility in your herd. So here are the outcomes of this particular study. Cows with high progesterone were at around 50% conception rates at pregnancy rates per AI at 29 days. Had a few losses at 57. You can see that compared to the low progesterone cows by 57 days, it was 47 versus 31%, big difference. And of course, pregnancy losses were much greater in the low progesterone group also. So you get fewer cows pregnant and you have more losses. That's a combination of horrible combination. And that's what happens with cows that have a low progesterone at the time you give the prostaglandin, unfortunately. There's a number of reasons for that. But anyway, the high progesterone group had limited losses in this case. The other thing that happened in this case that I'll talk about briefly at the end of this talk is that the high progesterone group had fewer double ovulations. Double ovulations, of course, can lead to twinning. So the high progesterone group reduced the chances for double ovulation, reduced the chances for twinning. And this was, didn't matter whether it was first lactation cows or older cows, multiparous cows, did not matter. In both cases, reduced the chances for double ovulation. And I'll talk about it a little bit at the end, how double ovulations will impact pregnancy losses. So double Ovsynch is it's really becoming our choice. Go back here to double Ovsynch for a second. Really becoming our choice for a program. The nice thing about double Ovsynch is that if you've got a high percentage of your herd, that's when you're around 50 days or so in milk that still are not cycling by that point, and you see a lot of variation amongst herds in this case. You probably, unless you're checking cows prior to during that period, which a lot of herds don't anymore, you wouldn't know whether your herd had a high percentage of anovular cows or not. But if you are one of those herds out there, or if you're a consultant and you have those herds, the double Ovsynch does the best job on those cows. You've got just about as good a chance of getting an anovular cow pregnant with double Ovsynch as you do a cycling cow. So because what it does, you've got a GnRH up front, it's got a chance to cause ovulation in that case, somewhere around a 70 to 80% chance, and to start a cow cycling again. Then you actually cause her to cycle with the prostaglandin, and you cause her to ovulate with the first GnRH, or the last GnRH of the first Ovsynch. So and then you're starting these cows, just like any other cow that's cycling, on about day 7 of the cycle, which is ideal. So this works really good. And if you don't know whether you've got a high percentage of your herd that's anovular or not, this is probably the way to go. And I like it for that reason. It's a little bit longer. It's a few more injections, et cetera, but it certainly does a really good job of getting cows pregnant. Very consistent results with double Ovsynch, and where you're looking at 50% conception rates, 47.2 after where most of the losses are going to occur. There's not too many programs out there that can do that, and I really like it because it can really enhance fertility in some of these herds that have a lot of anovular cows that are not cycling yet. This is a study that Jamie Strickland did in my lab when she was before she went to vet school and became famous. And she basically compared this study was actually done at Green Meadow Farms north of town. She basically compared Presynch 11 in which all cows received time AI in this case. And they can just barely see the end of that protocol there. But Presynch 11 basically is 2 prostaglandin injections, 14 days apart. Between the second prostaglandin and the first GnRH of Ovsynch, there's 11 days. So in this case, the first prostaglandin was the Thursday, the second prostaglandin was the Thursday, and the first GnRH of Ovsynch was on a Monday. And then they're breeding on Thursdays in this case, in this particular case. I think in this study, we actually either started cows on Thursday or Friday, and they inseminated on Thursday or Friday in this case back then. We compared that to cows that received prostaglandin at the same time. If they came into estrus, we inseminated them. If they didn't, we gave them another PG. If they came into estrus, then we inseminated them again. We inseminated those cows. So they had, cows had chances to, 2 different chances to come into heat and to get inseminated off of one of 2 prostaglandin injections there. If they didn't show signs of estrus, then they actually went to the same Ovsynch protocol. And so I'll split those out here in the data to show you what happened there. But for the most part, most of these cows were bred off the heats in this case. Pretty good numbers of cows in this particular study. So here's Presynch 11, 45%. This was a 39-day preg check, actually, in this case, and versus 31% in the cows that either came into estrus after a prostaglandin or the tail enders got the timed AI. And so, like I said, most of the cows, and I'm going to split it out here in a minute, but most of the cows did receive AI following a detected estrus in this case, a very high percentage. So big difference here in those 2 groups. The Presynch 11s did really well in this particular case. I'm going to talk about, just to briefly talk about the anovular thing again here, because Presynch 11 would not do as well in cows in a herd that has a high percentage of cows that are not cycling, let's say around 50, 60 days. So, and once again, that can happen, but it wouldn't work as well because what prostaglandin F2 alpha does in this case, you go back to what it does is it regresses a corpus luteum. A corpus luteum is there because the cow is cycling. The cow is not cycling, she does not have a CL there. So it doesn't do any good. You can give those cows prostaglandin all you want, it won't do anything to those cows. So they have to be cycling in this case in order for Presynch 11 or any type of a prostaglandin program to work. So think about that a little bit. And so in this case, big differences in fertility. So we had about a 50% increase, to be quite honest, in this particular case when you go from about 30 to 45%. So that's a huge increase in pregnancies off of first AI. And then if you split out the cows that only, well, no, this was by parity, I'm sorry. So you split out these cows by parity, you can see that the cows that received Presynch had the advantage all the way through first parities, second parity, and third plus parities there. So big differences between these. Go back a second here because once again, in this study, these cows, and I'm going to get to this a little bit later, these cows only received 1 prostaglandin injection during the Ovsynch protocol. And I say that if you're not familiar with the newest data that's been out there for a few years, we've been now giving 2 injections of prostaglandin 24 hours apart to ensure luteolysis. But in this particular study, in the previous study I just showed you, both those studies, only 1 prostaglandin in this case. So pretty good conception rates in this case with just the 1 prostaglandin injection here with the cows that only received timed AI. And the Presynch 11, once again, these cows that received Presynch 11 up there at the top, they got 2 injections of prostaglandin. If they came into heat after either one of those, we ignored them. We closed our eyes and let them go. Okay. All of those cows received time AI in this particular case. Every one of them received time AI. So that's the big difference in these two programs. I want to point that out because a lot of people cherry pick and do the top program. If you're going to cherry pick, you need to do Presynch 14. It's a lot simpler, and it wouldn't matter whether you did Presynch 11 in this case. We do Presynch 11 in this case because we want cows to get the first generation of Ovsynch around day 7 or 8 of the cycle. And that's what the 11-day interval that is there for. 10 or 11 days is perfect, to be quite honest. So it's strategic in that case in order to start Ovsynch at the right time. And these are cows that only get timed AI.
Richard, while you have that up, I got a question regarding use of Presynch 11 starting as early as 14 days post-calving. Advice on that?
It's a little early, 14 days, because Presynch 11, that first prostaglandin is going to do nothing. By the time you get 14 days later, the second prostaglandin might regress about 25 or 30% of the cows. Maybe a few more than that. There'll probably be 40 or 50% by then, possibly, but not a good strategy because there's really nothing there to regress. Can it have a direct impact on the uterus? Maybe. There's some data out there that would suggest that. But to be quite honest, what prostaglandin F2 alpha does is it regresses corpora lutea, and there's none there at that time at 14, or if there is, they've just ovulated. So no, I would not. If you want to start something early so that you're going to time AI cows really early, and if that's the strategy you want, I don't have anything against that. I don't think you're going to get. I think you're going to be cutting the cows short that you get pregnant that soon with regards to lactation. But once again, one thing you'll be doing is you will be making sure those cows will not be getting fat at the end of the when they calve in the next time. But you're really going to be cutting milk production short off that current lactation. I don't like that. I think we still have enough time. We can go out to around 75 days at least, and for first AI in that case. That would be at the time of the first AI, but you can count backwards. If I was going to do something and shorten that interval to first AI and do a timed AI, I'd do double Ovsynch for sure, because then you can cause some ovulations to occur and be able to get those cows synchronized, and the likelihood of getting them pregnant would be pretty good if you want to breed cows that early.
If you're looking, you mentioned this, if you're looking for a separate effect using PGF at 14 days for uterine effects, you don't recommend that because the data is not strong. Is that correct?
Well, I'm skeptical a little bit. I mean, I think it's pretty difficult to work through those data and determine whether there really was a big increase in fertility of any kind doing that. So,
okay.
There could be situations where it might help. We have never recommended that, to be quite honest, because the data just for us aren't strong enough in that case. It's basically there. I can recall actually doing some studies in Milo Wiltbank's lab as another grad student study way back. There are just very few prostaglandin F2 alpha receptors in the uterine. In fact, there's hardly any in the uterine endometrium. There's a few in the uterine myometrium. But really what causes uterine contractions, that kind of thing, to be quite honest, is you're looking at the prostaglandin can start the process if there's a CL there and a follicle there, but it's really high estradiol that's going to have the impact on the uterus. And in this case, you're not regressing to CL. So I just don't see how that mechanistically is going to affect the uterus that much. So
thank you.
That's just the way I interpret the data out there. So
yep,
that helps. Okay, so like I said, all cows, if they came in heat off the Presynch 11, those first 2 injections, we ignored them. So I just wanted to make sure I covered that. For certain, all these cows, Presynch 11 here, got timed AI. They all clearly a big difference in fertility. I know it's very difficult for people to consider not inseminating those cows, not cherry picking those cows. They're so used to doing that. but we have a lot of people not doing that now, and they're doing really well with Presynch 10 or Presynch 11 with their timed AIs. Now you go into this kind of a similar question there, Barry, with what if you've got cows that have some issues early on, some periparturient issues with uterine issues. No question that once they get out and you can regress a CL and cause an estrus, that it probably does help the uterus to involute a little bit faster, I would suspect. So getting rid of progesterone, progesterone is immunosuppressive. So getting rid of progesterone in this case by regressing the CL would be good. And that's one reason I think Presynch 11 works pretty well. So you're further out in lactation, but certainly if you can regress some CL and allow the uterus to involute just a little bit faster, then certainly that's kind of where the effect of prostaglandin could be, out a little bit further out once they've started cycling, no question. And you're dealing with some uterine issues out there. So Rob Gilbert's data on endometrial problems getting out, infections getting out in that period, 40 to 60 days, clearly real. And I think that's one way that this type of a program could have an impact on the uterus, is if you're out there and they do have CL and you're able to regress CL in this case, certainly could have a big impact. Okay, so big improvement in fertility there, all the way through parities, big improvement, as I showed you. These cows are only cows that were detected in estrus, or this was just the estrus group in this particular case, this entire figure. So by parity, if you look at the first parity cows, the green bar there are cows that received AI after the first prostaglandin. The blue bar are the cows that received AI after the second prostaglandin. And the red bar are the cows that went on to the timed AI that did not get inseminated off of one of the two prostaglandin injections. So that's first AI. You can see that the cows did really well, 40% conception rates off of detected heats there. That's really good. Don't mind that. I think, if you're detecting estrus, certainly the first lactation cows are the ones to do it in. But once you get out to the older cows, second and third plus parities, certainly big differences there compared to the first parity, and no differences in conception rates, whether it was the first prostaglandin, second, or the timed AI in this case. No differences at all between those for second and third plus parities, but you can see how low the conception rates are in those cows. And so this is the reason why I'm talking about doing something like a fertility program, double Ovsynch, Presynch 11, G6G, in order to get especially these older cows pregnant at first AI. So this is what you're dealing with, very low conception rates in these older cows, and you cannot have an impact with regards to getting these cows, all these cows pregnant before 150 days in milk. No way you're going to do this with these types of conception rates. So, okay, so that's those cows. We did have, did take blood samples of these cows. We had one prostaglandin injection. It helps to build my story on putting the second prostaglandin in there. Even the first parity cows were only at 87% luteolysis rate, which means that when they went through this, and these are only the cows that were in the Presynch 11 group that got all timed AI. When they went through Ovsynch, got the prostaglandin injection. In other words, there were 13% of those first parity cows that did not have CL regression, which means they had no chance to become pregnant. Second parity cows, 15%, no chance to become pregnant. And third plus parity cows, 19% of the cows, no chance to become pregnant. So when you consider that, and then you consider 45 versus 30, think about that for a second. That's pretty darn good. When you include these data and only account for the cows that actually had luteolysis, I switched the slide around here. Presynch 11 cows then had a 52% chance of becoming pregnant. So we've taken the cows out that didn't have luteolysis. So all we got to do is get all cows to regress their CL in this case, and we get really good fertility with Presynch 11. That's excellent. And so, but we can do that with additional prostaglandin. I'll talk about that a little bit later. That's compared to only cows that received estrus in this case. So this is this is timed AI. This is taking out the confounding factors of not having CL regression. 52% of our cows we could get pregnant. That's amazing. Compared to breeding to an estrus, 32%. So you take a look at that. What do you want to do? I know what I want to do. There you go. This is the same thing, split out by parity. Once again, only the cows that had luteolysis following the one prostaglandin, and big differences in fertility in first, second, third plus parities. All right. Okay, so then we followed up with a study that we compared Presynch 11, just like we did it, to G6G in this case, which is, we haven't talked about that yet, but the middle row there, it's starting with a prostaglandin, 2 days later, a GnRH, and then we start Ovsynch 6 days later. And the reason we did that, Nora Bello was a student in my laboratory that helped develop that. Mike Peters, prior to her, did a very similar study. We had the idea back when Mike was a student, but basically it's to try to set up cows to be on day 6 of the cycle. We noticed that a lot of our data, if they're on day 6, they got the greatest chance to ovulate a follicle to the GnRH, so to respond to that GnRH. And that's very important. Cows that respond to that GnRH versus cows that don't have about a 10 to 15 point advantage in conception rates with Ovsynch. So it's really important to get the first GnRH to cause an ovulation and create what we would call an accessory CL. In that case, we actually get an additional 50% more progesterone in circulation, which is ideal. So we start off with the prostaglandin, 2 days later a GnRH, and that is our pre-synchrony basically. And if they respond to those two, which about 65% of the cows did, then they'll be on day 6 of the cycle. And then we also had double Ovsynch in there. We did the double Ovsynch a little bit differently in this case, and also at the end you're going to see in Ovsynch we had a 72-hour period. This was in this particular study. We do not recommend doing that. We recommend 56 to 60 hours in there. But the reason we did that was based on some other data we had dealing with letting the follicle grow just a little bit larger to get greater estrogen amounts in circulation. And so that was part of the reason for those in this particular case. There's some other reasons I'm not going to get into. But basically, we had same comparisons across the board, Presynch 11, G6G, and double Ovsynch. We compared those three, and basically didn't see really much difference in fertility off of those three in this particular case. So they all performed at about the same rate. We had in the particular herd we did this, we kind of thought there were a few more uterine problems. It was kind of interesting. I don't show these data, but Presynch 11 in the multiparous cows did a lot better than the other two, interestingly enough, and especially if they ovulated to the first GnRH of Ovsynch. In fact, it was incredible how much difference we were at. I think if they ovulated to the first GnRH of Ovsynch, and these were just multiparous cows, we were at something like 53 or 4% on the multiparous cows, which we thought maybe the difference in the conception rates in this case could have been due to the two prostaglandins helping to clean up some uteri in this case. So it's speculation, but certainly those three programs compared very favorably to each other. The nicest data we got out of this was really was the relationship between progesterone at the time of the final prostaglandin of Ovsynch and fertility. And the higher the progesterone, the more cows we get pregnant. And this was 39 days post-AI. So this doesn't even include any cows you would have that could have losses due twins, as we would know now, that would occur just after that. So big difference is the higher we can get progesterone up, the greater our fertility is. And so that's been kind of our mantra a little bit in these programs, is how can we get progesterone as high as we can prior to the prostaglandin, or at the time of the prostaglandin, and then get rid of those CL and regress those CL in a timely manner. So that's kind of the, we don't know exactly what it's doing, to be quite honest. We know that that having higher progesterone reduces double ovulations, reduces twinning, but these data wouldn't, this particular slide here would not include those cows, because usually those cows that have double ovulation and twins, as I'll talk about later, don't lose their pregnancies until after this. So this is kind of where we're headed with these programs. And you can see that if we can do that, we can get close to heifer level fertility in these lactating dairy cows, which is pretty impressive. And I think that's the key. Especially for first AI, I think we can keep working harder on first AI and get our conception rates up into the 60-65% range. Still want that to happen. If we can do that, we can solve a lot of problems. I know there are herds out there right now, even in Michigan, that are up in that range. One with G6G, and there's a few out there that are up in the upper 50s and that are doing this right now. So the key though is to get progesterone really high, and that's what these fertility programs do. They get progesterone high during that period, as I showed with double ovsynch to begin with. So sometimes you'll have cows that show estrus or come into heat day 7, 8, 9, 10, 11, 12, 13, 14 in there after you breed them. And it's about the only data we've collected to kind of help us understand why. And you can see that most of those cows that came into estrus, so this was in a previous study that were, is actually the study where we compared double ovsynch to G6G to Presynch 11. Cows that did come into heat early were the cows that did not have complete luteolysis following the prostaglandin in that case. And there weren't tons of cows in that particular study with, because we did use 2 prostaglandins in those studies, but not tons of cows there that would have not had luteolysis, but certainly the ones that were in that group a lot of them came into heat early there. So kind of interesting. You can see where the rest of the cows that didn't become pregnant off of first AI, where they landed. A lot of them were in 22, 23, 24 days later. So that's pretty normal actually. So, okay. So a lot of these cows that we give one injection of prostaglandin to are not having complete luteolysis. We've shown these data for years. So J.P. Martins was a student of mine, both a master's degree and a PhD student, and he collected these data. These were actually collected at Green Meadow Farms also. But you can see the cows there, the very top line there, where we got recovery there on the right side. Those cows, progesterone came down after the prostaglandin injection, but then came right back up. There were 68 cows out of 489 that did that. Then they had a group that we called incomplete that came down a day later, but then just leveled off. We called those the incomplete group. And then we had a delayed group. And then the very bottom line down there was the complete luteolysis group. You can see that was most of the cows. But still, we had 119 cows there that did not have what we would call complete luteolysis by 56 hours, which is when we give the GnRH injection. And 2 out of those 119 cows became pregnant. And those cows were just above our cutoff for progesterone. Our cutoff was 0.5 nanograms per mil progesterone. They were at 0.52 and 0.56, something like that. To be quite honest, they probably had CL regression, but we had to have a cutoff there for the purpose of figuring out where these cows landed. And so if they were incomplete or recovery group, there's 100 cows there that had had 0 pregnancies in that group. So if you don't get luteolysis, basically you don't get pregnancies, bottom line. So it's really important because, as I showed you earlier, there's somewhere between 14, 19% of the cows that don't have luteolysis. So this was a study by Denise Brusmean in Mila Wiltbank's lab back a few years ago, where she added a second prostaglandin to double Ovsynch there 24 hours later. And here were her data. The double PG in this case, she was at 96% luteolysis rates, pretty high. You know, like I'm saying, that's only 4% that did not have luteolysis compared to what I was showing you earlier, that we were looking at somewhere between 14 and 19% not having luteolysis. So big jump. So in other words, you got about 10% more of the cows in this particular case, in this study, that had a chance to become pregnant. And if you're at 50% conception rates thereabouts, that's about 5 points, and that's about what she got, about 47 to 52.7% conception rate. So mathematically, it works out perfectly. It's not different statistically in this case, but to be quite honest, when you consider that it's an all or none deal, cows that don't have luteolysis do not have a chance to become pregnant, then that's significant. So clearly, we're seeing at least that 5-6 points. Some people have reported 7-8 points, but we're clearly seeing 5 to 6 points increase in pregnancy rates per AI when we add this second prostaglandin to the protocols. We are even adding it now to everything. So we want to make sure we regress the CL, because it's a big limiting factor to these protocols if we don't have that in there. So the other study where we had 2 prostaglandins, the one where we compared double Ovsynch to G6G to Presynch 11, you can see with 2 prostaglandins in that study, basically very high luteolysis rates, which only leaves a few cows that won't get pregnant in this case. And that's by parity. You can see still the older cows struggling just a little bit. That's where the problems are for the most part. The younger cows, a little easier to get luteolysis and so on. So, okay, going to get into Resynch here quickly. So if we don't get cows pregnant after first AI, we've still got 2 chances, right, to get them pregnant before 150 days of milk. So there's a number of strategies that certainly you can utilize. This is a study by Glaucio Lopez and Paul Fricke's group at the University of Wisconsin. He compared what they call a GGPG versus a GPG. They did it at 2 different times, basically. And they did an open check in these first 2 bars, the open check at 32 days post-AI. That would be at the time of the first generation of Ovsynch. So when you look at just the GP, the second bar there, GPG 32, the preg check was at that first G, okay? And then they made a decision what they were going to do. So in the GGPG, they gave the GnRH a week ahead of preg check, and then it came in at the second GnRH and did the preg check. And if they were the open check, if they were open, then they received the rest of the program. You can see the conception rates there, pretty decent, 37, 34%. They also had a day 39 where they started. So the day 39 one would be a 42-day interval. The day 32 would be a 35-day interval between AIs, just so you know. And pretty good conception rates. They were out just a little bit further there. But the G in this case, of the GGPGs had a significant impact on fertility in this case. When you look at the numbers and you add those 2 GGPGs versus the GPGs, there was a difference in fertility in those 2 groups there. So that looks pretty promising. That's been out there for a while. Group that Todd Bilby had worked with a number of years ago, also compared, and can't see the top one there. Barry, is it possible? Is your picture in there, or is?
I think we can see it okay on YouTube.
Yeah. Okay. Trying to remember what the number was at this point, but they had the top line was a Ovsynch control. And then they had a GGPG in which they did basically the same thing as the Fricke study, the Glaucio Lopez study, where they did their open check at 39 days post AI in this case, all the way through. So you can see the conception rates there, pretty favorable. I think the GGPG looks pretty good. We think, and I'm a big fan of, to be quite honest, of Cedar Sync. If that's all you can do, really like Cedar Sync in this case, using the GnRH, putting the Cedar in at the time of the GnRH of Ovsynch, pulling it out. Basically, what we do, just so you know, is we pull. I'll show you here, and I'll show you some calendars here in a second. We'll pull the Cedar out. To be quite honest, in our stuff, we would recommend pulling out the second PG. So we would recommend having 2 PGs in all these. I think you would have seen a higher fertility all the way through here, but back then that wasn't. Some of those data weren't out yet. So, I'm going to show you a few. This is a 42-day interval Ovsynch for resync. This is, for example, if you can only check on a Thursday. This is just, you can go through a lot of different examples here of different ways to resync. I'm going to just show you a few. If this is in a herd we're working with north of town, they're doing the open check at day 35. It's a Thursday, so we go in and give a GnRH on the Monday before that. Not quite like that at this place, but close. Prostaglandin then the next week, and then we do a second prostaglandin the next day, and then we're time AI. So it's just an Ovsynch basically, but we're giving the GnRH basically ahead of the open check in this particular case. It's one way to do it. There's a number of different ways to do that. In the previous studies, and some of the other previous Fricky studies, they were, for example, checking on a Monday, doing the open check on a Monday, and they were given a GnRH a week before that, which would be day 28 post AI. This would be something similar to that, where you're checking on a Monday at day 32, where you're giving GnRH a week ahead. This would be what I would call what Paul Fricky, I think, had intended to do. And what he would recommend in a lot of herds, I think, is to go ahead and give the GnRH up front on all cows. Just got to be really careful when you do those things with compliance, and you're certain that your guys out there are giving GnRH and not prostaglandin F2 alpha, because that could be disastrous, of course. Got to be really careful if you're doing this on all cows. Then, so then you're ahead, you get to the open check, and if they're open, then all you can do is give prostaglandin, and you're inseminating those cows by the following Thursday. So basically a 35-day interval there between AIs. This would be a Cedar Sync, for example. Cedar Syncs on cows that only checked open, basically, if you can do that on day 32 with ultrasound. And so you'd be GnRH plus Cedar. And then we're pulling the Cedar out, as you can see, after the second PG. Still, when you consider how much progesterone is there, still in circulation after the first prostaglandin, they're down to around 1 nanogram per mil by that time on Tuesday, maybe a little less than that, but they're not complete luteolysis yet. They're still circulating progesterone from that CL that's regressing. It's okay to leave the Cedar in until then, because the Cedar, once it's pulled, it's another hour or two, all the progesterone from that Cedar is out of circulation. So basically it's timing the pull of the Cedar. And the nice thing about that is that if those cows had early CL regression for some reason, if you leave the Cedar in until the second prostaglandin, you will not see cows coming into heat early. And so those cows have a much better chance of becoming pregnant to the timed AI in this case, if they had, or for some reason, if they had early CL regression, which can happen with resync programs, no question about that. So I like leaving the Cedar into the second prostaglandin. It's another good reason to give another prostaglandin. Even if you didn't give a second prostaglandin, I'd leave the Cedar until the next day, just to be sure that if they did have early CL regression, which you wouldn't know, they've got progesterone to that point, and then they should synchronize really well at that point. This is something we did in a previous study in the last couple of years, where we went in and gave, can't show you any data, but all I can tell you is it worked really, really well. It's probably the best resynchronization program we've seen so far, at least in our hands. we went at day 18 and day 25. Now, one thing we did is we're developing a new way to determine pregnancy early by collecting 2 samples of blood samples and testing them for PAGs or PSPB. In this case, we're using PSPB from the Bioprin laboratories. And so we have a way to determine whether these cows are pregnant really early. We're not ready to showcase that yet. We're still making sure our calculations are correct with regards to how we determine which cows are pregnant, which cows aren't. But certainly it's very promising. But we're very accurate in this case. In a previous study that we got published in Journal of Dairy Science, very accurate in determining pregnancy early. And so we had a couple of samples there early on. So we knew whether these cows were open already. And so we didn't, in this case, we didn't do the open check. I put that in there. If you can do a Monday open check with ultrasound on day 32, you could do this program. The herd we were in, we couldn't because they're at a day 35 preg check, we couldn't do that. But certainly if you can go in on a Monday or whatever day, you know, even if it's a Tuesday and you start your programs on Tuesday, if you can go in on the day that you're starting your programs, and preg check, do the open checks, then works out pretty well, actually. So you can give 2 injections of GnRH, day 18, day 25, and we got really good conception rates and big numbers off of this. Still not quite got all the, completely got the data collected to show you, but the key here is you got to have perfect compliance, because if you got a group of guys going out giving injections and they make a mistake and give those cows prostaglandin at that time, you're in trouble, big trouble. So I wouldn't recommend this for anyone that has any doubts about whether their cows are getting the right injections or not. It's a little risky. So we are looking at this in herds that certainly can get this done perfectly. So this works pretty well, and certainly pretty excited about the results from this one. Once again, it's basically it's a GGPG, but we're starting much earlier than the GGPGs I was showing you earlier. Anyway,
Richard,
working
with
pretty
current,
well.
I'm sorry. With current PAG testing options that are out there commercially, how short do you think you can go in terms of pregnancy detection? 29 days? Can you go that low?
Yeah, with one sample, you can go around 28, 29 days. Yeah.
Okay. Yep.
So should be pretty accurate. You may have a few rechecks, but 28, okay. Yeah, you can go to 28, and you may have a few rechecks that aren't, but it's not going to be lots. So,
yep. Okay.
Certainly, but we were doing 2, and we were pretty accurate. So we could go a little bit earlier, but some point I think we'll be able to showcase that at some point out in the field, hopefully.
Yep. Okay,
so real quick on pregnancy loss, showed you these data a little bit earlier where the high P4, the double Ovsynch had greater or fewer chances for double ovulations and fewer losses, basically. We did a study, JP Martin's did a big study, and one of the outcomes, I'm just going to show you real quickly, one of the outcomes was the effect of double ovulation on pregnancy loss. And from 35 to 56 days, big increase in pregnancy loss in these cows. So over around a 13% chance for a loss. 71% of those cows, and that's in the double ovulation group, 71% of these cows in this double ovulation group that lost had what we called unilateral double ovulation. So they had two follicles ovulated on the same ovary. Okay, and that's so basically this cow would have had twins in the same horn. All right, so 71% of those cows that lost had unilateral double ovulations. There's really good data from Lopez Gadias from Spain on this back years ago, to be quite honest, with regards to bilateral versus unilateral pregnancies. We didn't actually have the pregnancy information in this particular case, but certainly this agrees with Lopez Gadias's data from Spain on this. And so pretty interesting that these cows that have most likely have twins in the same horn have a much greater chance of losing the pregnancy. Not quite the same 56 days to post-calving, but I put that up there because most of Lopez Gaudius's losses were around 60 to 90, I think, somewhere in there. Ours were just a little bit sooner than that, but still getting a lot of losses in these cows with double ovulations. And they're the ones that have ovulated in the same ovary and would likely have twins in the same horn. So few people out there in the U.S. right now are going in early, and they're actually turning these cows. To be quite honest, these cows don't have a great chance of making it to calving if they've got unilateral twins. And so we've got guys out there now that are actually taking advantage of this information. And if they have a cow that's got unilateral twins, they're given a PG. That's early on. That's in the first pregnancy check. And so we have no data on that. Paul Frick and I talk about this a lot. He would prefer to try to pinch the heads off, but we would just prefer to give prostaglandin and start those cows over again, because they're going to have a really, really high chance of losing anyway. The problem with that is they get way too far out into lactation, and those cows have a much greater chance of getting culled in that case because they're losing much further out. So something to consider, probably a cow by cow decision, that kind of a thing. So thanks. I appreciate the opportunity to do this. This was the way my lab looked, I don't know, around a year ago, something like that, when we took this picture out at the MSU dairy. So appreciate it. This is our picture on the front of our website, dairycattlereproduction.com. You can go on there and find a lot of information on there. So, but certainly very appreciate the opportunity to come in and do this presentation today. Thanks.
Richard, excellent. Thank you. It's a great summary of, well over a decade of work across multiple labs, I guess. But I do really want to encourage, as I'm somebody that's not a reproduction person, but this website, I think, is very accessible, very practical, and a lot of useful information there. So I want to encourage everyone to take advantage of that. With that, we'll wrap it up for today. Thanks again, Dr. Pursley. And please join us on Thursday again for our next webinar in this series, where we'll feature Dr. Dana Kirk from the Ag Engineering Department at Michigan State. Thank you.
Take care.